In this video we will talk about top foods to avoid during pregnancy diet plan. Don't forget to like, share and subscribe to our YouTube channel to be notified when we upload new videos daily. Top foods to avoid during pregnancy. It is essential that you take care when preparing foods and avoid doing certain things when pregnant. This is due to your baby's immune system not being sufficiently developed to fight any infection you may pass to it whilst within the womb. It is believed that a female's immune system may not function at its peak during pregnancy, so it is essential that all necessary precautions are taken. Pregnancy is one of the most vital and sensitive periods in a woman's life. Therefore, it's very important for pregnant women to eat a healthy diet. Expecting mothers have to pay close attention to what they eat and make sure to avoid harmful foods and beverages. Certain foods should only be consumed rarely, while others should be avoided completely. When you're pregnant, everything that goes into your mouth gets shared with your growing baby. Some types of foods and some types of food poisoning may not hurt you, they may harm your little one. Meat. Do not eat raw or undercooked meat or poultry. Also avoid meats which have been preserved in nitrates such as salami, frankfurters and luncheon meat. Always cook meat so the juices run clear and there is no pinkness or blood within. When touching raw meat and poultry, always wash your hands thoroughly before touching any other foods. Liver contains vitamin A in the form of retinol, which if taken by a pregnant woman can increase her levels way above the recommended daily level and become damaging to the baby. Liver should be avoided as well as products containing liver such as pate and liver sausage. Why? There is a risk of toxoplasmosis, a tiny parasite that lives in raw meat, soil and cat poo and can harm the baby. Milk. Avoid all products which have not been pasteurized. All pasteurized products are safe to use all through pregnancy and beyond. Why? There is an increased risk of toxoplasmosis, listeriosis and campylobacter. Liver products. Don't eat liver or liver products such as liver pâté or liver sausage, as they may contain a lot of vitamin A. Too much vitamin A can harm your baby. Supplements containing vitamin A. Don't take high-dose multivitamin supplements, fish liver oil supplements or any supplements containing vitamin A. Why? Liver has high levels of vitamin A, and too much of this can harm your baby. Pâté. Avoid all types of pâté, including vegetable pâté. Why? They may contain listeria. These are bacteria that can cause an infection called listeriosis. Listeriosis can harm a baby during pregnancy or cause severe illness in a newborn. Liver pâté can also have high levels of vitamin A, which is harmful to the baby. Cheese. Not all cheeses contain the bacteria, but there are some which can be potentially harmful to a pregnant mother. Avoid both pasteurized and unpasteurized soft cheeses which usually have a surface mold or rind such as brie, camembert and Danish blue. Also avoid cheeses coated in wax such as Gouda, Post-Salud. It is best to stay clear of the majority of blue cheeses such as Stilton, Gorgonzola and Roquefort. Hard cheeses such as cheddar, Parmesan, and red Leicester fall into the safe category, as do softer cheeses made from pasteurized milk such as cottage cheese, mozzarella, ricotta, processed cheese and cheese spreads. If in doubt, play safe and avoid eating it. Why? There's a risk that these cheeses could contain listeria. Undercooked or raw fish. Raw fish and shellfish can be contaminated with bacteria and parasites. Some of these can cause adverse health effects and harm both the mother and unborn baby. Eggs. The Salmonella bacteria are most commonly found in eggs. It is best to avoid any foods made with raw or partly cooked eggs, such as homemade mayonnaise, meringues, cheesecakes, sorbets or mousses. Eggs are only safe if they have been cooked long enough so that their yolks are hard. Shop-bought mayonnaises are usually safe as long as they have been made with pasteurized eggs. Always check the label if in doubt. Organ meat. Organ meat is a great source of iron, vitamin B12, vitamin A and copper. To prevent vitamin A and copper toxicity, pregnant women are advised to limit their intake of organ meat to no more than once a week. Caffeine. Pregnant women should limit their caffeine intake to 200 mg per day, which is about 2 to 3 cups of coffee. High caffeine intake during pregnancy can limit fetal growth and cause low birth weight. Alcohol. It's safest to avoid alcohol completely during pregnancy, especially in the first 3 months. If you do choose to drink after that, keep it to a maximum of 1 or 2 units, no more than once or twice a week. Why? Alcohol can harm you and your baby, and experts cannot be sure that any amount of alcohol is safe. Raw sprouts. Raw sprouts, including alfalfa, clover, radish and mung bean sprouts, may be contaminated with salmonella. Raw sprouts may be contaminated with bacteria inside the seeds. Pregnant women should only eat cooked sprouts. Unwashed produce. The surface of unwashed or unpeeled fruits and vegetables may be contaminated with several bacteria and parasites. Fruits and vegetables may be contaminated with harmful bacteria, including toxoplasma. It's important to thoroughly rinse all fruits and vegetables. Processed junk foods. Eating processed foods during pregnancy can increase your risk of excess weight gain, gestational diabetes and complications. This can have long-term health implications for your child. Seafood. Oysters and any raw or uncooked fish should be avoided. Also, shelled seafood such as crab, prawns, and langoustines should be avoided unless they have been thoroughly cooked and are hot. Most seafood bought from a fishmonger or supermarket should be safe. Fresh tuna should only be eaten once a month due to the potential levels of mercury found within. This is also true for swordfish and shark. Tinned tuna contains lower levels, so this is safe to eat every week. Salads. All pre-paired shop-bought salads are best to be avoided. So too are dressed salads such as coleslaw, potato salad and Florida salad. It is best to make your own and ensure that all leaves are thoroughly washed free from soils and other deposits found on the leaves. Peanuts. If you would like to eat peanuts or food containing peanuts such as peanut butter during pregnancy, you can choose to do so as part of a healthy balanced diet, unless you are allergic to them or your health professional advises you not to. Exclusion of any particular foods, including foods considered to be highly allergenic, from the maternal diet during pregnancy or breastfeeding is not recommended, as this has not been shown to prevent allergies. Energy drinks. Energy drinks are not recommended during pregnancy as they may contain high levels of caffeine, and other ingredients not recommended for pregnant women. Raw shellfish. Eat cooked rather than raw shellfish as they can contain harmful bacteria and viruses that can cause food poisoning and have a higher risk of listeria contamination. Warning: None of the information on our videos is a substitute for a diagnosis and treatment by your health professional.